The Research Design Service, the RDS, was established a little over 10 years ago now, probably close to 12 years in fact. And although we're a national service across England, we're organised into 10 separate regions. So we are the North East and North Cumbria Research Design Service. The original intention when the RDS was initially funded and set up was the then Chief Medical Officer, Sally Davies, had the aim of increasing the number and proportion of high quality applications that were submitted for funding for health related research. And essentially what we do, as you'll hear as I tell you more about our service, is complement very much the service that's provided by the Sir Bobby Robson Foundation Cancer Trials team that Natasha's outlined. We work very closely with that team, and indeed there's quite a lot of overlap in personnel. The difference really, I think, is that we have a broader remit, so we support researchers working in any health or social care related settings, so we're not limited to cancer research. And I think the other thing to say is the one thing we wouldn't do is to actually help with the grant writing unless it was in terms of a member of the RDS no longer acting as an RDS advisor, but being a collaborator on the application. So I'll just see if I can move on to my next slide. There we are. So who we are, there are, as I say, a number of us on this call today, and so probably many of you will know us, but we're a broad team of both general methodologists and specialist methodologists. So we have qualitative researchers, statisticians, health economists, PPI specialists, trialists, and many other specialties. And what we do is similar to what Natasha's already outlined, but as I say, in this sort of broader arena, we will support investigators who are seeking funding from any nationally peer-reviewed funding competition, which is related to applied health or public health or social care research. So investigators can come from either academia or clinical settings or indeed third sector organisations sometimes. And we support people from any institution, from any of these institutions at any stage of their research career. So we support people right from very early career researchers going for early funding, right up to people who are very well established and have professorial type roles. And so what do we do? So the service we provide is completely free and confidential, and we can provide advice on all aspects of research study design and the kind of wider field of writing a successful application. And as I say, we support applications for funding to any peer-reviewed national funder. So we are funded by the NIHR, and so they are kind of where a large proportion of our work lies, and we have a lot of insight into those funding streams and what the funders are looking for. But we also support other funders who are eligible for UK CRM portfolio adoption, so really the UKRI or AMRC funders as well as the NIHR streams. And as I said earlier, we're quite a wide group in terms of our expertise, and we have access to, we're fortunate in having access to statisticians, and particularly Dawn and James, I know are on the call, and I'm sure others as well, with who have a real interest in innovative and novel design. So that's a real strength for us. So all that expertise around statistics and trial design. We also have advisors who are experts in qualitative work, health economics, behaviour change and health psychology, epidemiology and public health, evidence synthesis, and so on. And we've already spoken about PPI, which again I'll say a little bit more about as well. Okay, so this is the busy diagram which Natasha said she thought perhaps some of you would have seen already. I know you all have seen it already because you've just seen it, but this is the one that we do like to use just to sort of demonstrate that writing a really good quality research proposal is about more than just the study design. So I won't go through all these aspects again, as Natasha already has, but there's a lot of components that go into writing a really good quality application. so obviously the study design is important, and we can help to think about, as Natasha was saying, whether an RCT is the most appropriate, whether you want an innovative design, whether it should be a qualitative study, a longitudinal cohort, all the different study designs we can help you think through. But there's also all these other aspects that we have to think about as well. So what happens if you come to us? We encourage people to contact us via our website, to fill in a contact form, just giving some information about your study idea. And that can be, you know, whatever stage you're at, we encourage you to come as early as possible. The earlier, the better. So maybe it's just an idea at the moment, or some people come with something that they've really worked up, and it varies from person to person. But we ask you to give us a little bit of information when you make the initial contact. And that then helps us to allocate you to one of the general advisors, which is someone like me or Natasha, or we have several other general advisors. And then if each case is sort of works in a different way depending on what's required by you as the researcher, but in general we would then go on to have an initial meeting with the general advisor and you as the researcher, in which we think about all these aspects of the research proposal. So the design, have we got the correct team, what's the sort of really honing down the research question and making sure there's not an existing study already ongoing which is addressing that and these type of issues. And then after that meeting, we'll decide what sort of specialists you require, or what additional support you might require that we could help with. And then from there, subsequent meetings will be arranged, or communication by email, or whatever works best for you. And obviously at the moment, most of these meetings are happening remotely. But we're as flexible as we can be to ensure we can fit in with the researchers' needs and requirements. And in terms of the specialist advice that we provide, we have specialists right across the region, so we can provide the best advice in terms of both geographically, but more importantly, who has the most appropriate knowledge and can best support the application. So we can draw on people from a really wide base for that. I just move on. So we talked a little bit already about PPA or PPIE, which is patient and public involvement and engagement. And Natasha mentioned how important that is. Importantly, that is viewed by funders, and increasingly so, I would say. So since I've joined the RDS, which is maybe 4 years or so ago now, I think, it was important then, but I've seen it become more and more important as I've worked for the RDS. So this is one of the things that we can certainly help you with, and we have 2 PPI specialists within our team. So just as a reminder, I'm sure most of you are aware, but it's important to think of PPI and think about this in terms of research being carried out with or by members of the public rather than to, about or for them, so that you're really involving them in how you design that research and making sure that their thoughts and their ideas are embedded in that. And I think it's also worth thinking about the public in a really broad way. So it's not necessarily just the public and patients, but it's all the people that might be affected by your study. So all the other stakeholders, and sometimes that, or quite often in fact, that might include other professionals, so other clinicians who might be involved in delivering the particular care that you're interested in researching. So we're fortunate, and I think one of the things we're really proud of in terms of our particular RDS is our patient and public involvement, and we have our own RDS consumer panel, whose photograph is still appearing on my slide. And sadly, I haven't seen them in this format for quite some time. So since March, all the meetings have been virtual, but that's in some ways worked really well. So we've been able to be really flexible about giving access to the consumer panel for to have their input into applications. So the panel currently meet regularly to do these virtual panel meetings where a researcher can come along, present their ideas and get some really useful input from them. They'll also very happily review applications online, so via email, and they're really, really valuable in terms of being able to comment on plain English summaries and really help to make sure they are plain English summaries and understandable, which is really important part of any application. And I think that's all from me, really. So these are our contact details. As I say, we encourage you to contact us via the website and fill in the contact form there. And to do that as early as possible, really. I think the earlier the better is the message.